Mkhize is on a 2-day visit.
We had was a chest hospital, or what we call Richmond TB hospital. And over the years, with the declining numbers of TB, it was now getting dilapidated. Now with COVID-19 and the need for making services available, MEC has been able to get this place revived, which I think has been a very, very good idea. And what is even better is the fact that it's now looking much better than what it used to be. And therefore, we now got a district hospital in Richmond, which should have been there long ago. And I believe, therefore, that we've now got an investment that's going to cover this whole area from Richmond down to Clairwood, down to Smozomeni, down to Masamini, towards the other side of Mkomazi, going to all the way towards Ikopo. It really becomes a very important catchment area. It's also been so well done that in fact you can actually begin to develop ICU capacity, which means you can intervene on patients who are coming here. And why that's important is because you've got a very bad road between here and Ikopo, and this Mkomazi Valley creates a lot of accidents between here and Ikopo, and therefore it's important. It's a route coming from Johannesburg towards Transkei, towards Umtata, towards Kokstad, and therefore it tends to have lots of accidents. Now you do need emergency relief capacity nearby before someone gets to the big hospital. So it's a wonderful investment as we are seeing today. However, we came here to sit in the context of COVID, and the 95 beds that are going to be developed here are actually going to be very much welcome, and we actually are happy that someone has been able to push for this thing to happen quickly, which tells us that things can happen much better if there's focus. Now, I think everyone can now explain why things are slower later. So it's a very, very important thing for us. But what is important for now is that some of the wards are already being occupied, and therefore we have got good staff complement, good management, and it's important to say to our people, we are managing, we're ready, we're going to be taking more and more patients, we're ready. And so this is just one of the small village hospitals or small town hospitals, and that's why I've been focusing. Now the point which I think is important is to make a call to all our people, in particular the senior citizens, people with comorbidities. You get a flu-like symptoms, don't wait, come to hospital. You get a slight cough, cold and so on, don't assess it yourself, come to hospital. Because we are seeing a lot of complications when people are at home and all you get is a report, no, you have diabetes, but this now is now passed. Now we are saying it can be managed, so people must be brought to the hospital earlier. They mustn't wait until things are too complicated. I think kubalulekile ukuthi sichazele umphakathi ukuthi lesifo lesi se-COVID-19 siyabambeka uma singasikwazi ukusukuma sibambisana. Ngakho-ke kakhulukazi emakhaya obaba nomama sebekhulile nalabo abanezifo abahlala khona abalanda imithi ezibhedlela mabaqhubeke balanda imithi bathole yonke i-treatment abayidingayo. Kodwa uma ubona ngathi unomkhuhlane ungazikaleli ukuthi hayi mina ngi-strong lo mkhuhlane ngizowehlula. Uma uzwa nje ukuthi unomkhuhlanyana sukuma uye ngasesibhedlela, ngoba make wami usuku olulodwa noma zambili ugcina ungasakwazi ukuvuka embhedeni. Uma ufika esibhedlela sekukude kakhulu. So siyacela ukuthi abantu abasondele. Siyabona manje ukuthi nabantu okugcina manje uthola ukuthi sekubikwa nje ukuthi hayi ufika walala ekhaya ebusuku avuke engasakwazi ukuvuka abangasafika esibhedlela. Konke lokho sithi funa sikwazi ukunqanda. Ngakho sifuna basondele basheshe bafike esibhedlela khona bezokwazi ukulapheka, ngoba lokho kuzokwenza ukuthi abantu abaningi babe ngcono. Kunale mithi esitholakele yenza ukuthi noma ngabe besikhandle kakhulu isifo odexamethasone laba ubuya ngisho ICU ujove uthole oxygen ubuye uphinde ekhaya. So kubalulekile ukuthi abantu abasondele, abangabaleki futhi abantu ezibhedlela ukuthi hayi ngizothola iCovid esibhedlela. Isikhona nala emphakathini. So wena landa amaphilisi akho, ungahlali unganayo imithi, TB, BP, HIV, wonke le maphilisi lawa owadla zonke insuku wadle uwathole, wenza isiqiniseko sokuthi umzimba wakho ulaphekile. Siyafika nje lesifo sibhekana naso, kungabi ukuthi sibhekana nalesifo kodwa lokho bekuhlale kukuphatha sekujule kakhulu kuqala. So lonto ke sifuna ukuyicela ke emphakathini. Let me also say thank you to Professor Magula and the team from the university. There's another advantage now of responding properly to COVID. One, is that we're going to be putting up facilities even in areas where they didn't exist. We're going to do that quicker than we've seen them being done, as we've seen here. But in addition, we're also going to make sure that there's stronger collaboration with the university as well as with the private sector. In the case of the university, we would like the tertiary institutions to take responsibility for the mortality and morbidity outcomes of all the hospitals, of all the regions, because they are at the top of the range in terms of the management of the various diseases. So in this case, we are very pleased that a university professor is here to look at things so that we can then say together we're planning for the tertiary level care, for the regional level care, for the district level care, and for primary health care, all of us together, and therefore we know that the way we treat people is such that they will be treated at the appropriate level, they'll get to the higher level because there's need. And in this case, the system is beginning to fall into place where you will move from the clinic to a district hospital, and the regional hospital, which is where everybody used to go, is about 40 kilometers from here. It's something that we need to make sure is corrected as we move on. So this correction has started to happen here. So thank you very much. Somebody wanted to ask a question? There were two questions I was told, so I'll wait for two questions.
Just two questions.
Okay.
Minister, thank you.
It's two questions, one person? Or it's two questions,
No,
two people?
it's Coscona was going to ask and then go.
Or it's two people?
Two people, yes.
Okay.
Just two questions, Minister.
Okay.
First and foremost, there are fears that really stem from the threat that was made by trade union Nehao. They said that they are going to encourage their members to stay away on the 28th of this month. Are you engaging them, trying to make sure that that doesn't take place? And really, because that would be unfortunate, as it will take place where we expect to see a surge. My second question is, the latest details that you've given in terms of recovery rates in this country is now just at about 70%. We've seen calls coming from Business Leadership South Africa, as well as the South African Medical Research Council, saying that the alcohol and cigarettes ban has achieved what it needs. Now, there are fears, obviously, and worries from people who work in this sector, saying that hearing all of this, why isn't the ban being lifted? If you could just give clarity on that, why isn't the ban being lifted? Why is government insisting on it?
All right. Firstly, we have a came from Nehao. We have been liaising with Nehao. We are looking for a date to engage them in a meeting. As soon as that has been finalized, we'll be able to deal with it. The Director General and the Secretary General of Nehao are the ones who are trying to work on that. So we have prioritized the meeting with Nehao. We also are going to have a meeting with other trade unions together. And so we have already had a meeting with the Medical Association. So we are prioritizing the issues that come from the trade union, mainly because when they raise issues through the unions from the staff in our institutions, quite often where the management is actually not able to give us exactly the same report. And so we want to make sure we deal with them. We've already had a discussion with the National Health Council, which is all the MECs and heads of department. We've insisted now that there must be regular contact between unions and management at each and every province, at each and every district, and at each and every facility. And we've given provinces a week to make sure that those occupational and occupational health and safety committees are working within 1 week. And we are urging all our members, our staff, to be able to raise their issues with the unions, with management. But we know that if the issues aren't resolved at that level, when we meet with the trade unions, they'll be able to raise those issues with us. And so we're quite happy to deal with that. In some of the instances where there are problems of irregularities, corruption, we're encouraging our members to be whistleblowers, send us information either through the unions or the Medical Association or straight to the ministers and the MECs. We'll institute investigations at that level. We would be concerned more about what is it that makes our partners to be uncomfortable in the case of trade unions. So we will want to address those issues. Now we're just waiting for a date to be confirmed between us as the head office and the trade union Nehao. But in every hospital, in every province, we expect that those meetings should be taking place, and this one should be over and above that one. Yeah.
Sorry, on the
then the issue of alcohol and tobacco. Look, our focus as the health department is about the health of the nation. And therefore, where we think that certain practices will compromise the health of our people, we will not hesitate to stand on the side of the health of our people. And that's where we stand. And therefore, when we deal with these issues, we take a view based on what we see as the situation on the ground. And when things change and we think that it would be safe to ease off certain things, we'll certainly do that. Now, I was in Edendale Hospital. The first thing that the intensive care specialist was, I said, how was the situation? He says, well, it has helped the fact that we don't have so much trauma, and that alcohol-induced trauma is reduced. It makes it easier for us to work. I find this everywhere we go. Now, our position is very simple. When we see that the numbers are improving and that the need for pressure for beds is not so threatening to the lives of our people, then of course we will reconsider this. We haven't come to that point yet. Right now we've been taken to court. Now we can't be asked to go to court on the one side and we must answer the media, we must answer everybody. They must be clear. If we're going to be taken to court, we will go to court. We don't have to answer. Because the problem is that we can't be answering in public and in the thing because it's supposed to be sub judice. So I think we must just be aware that there's that problem as well. But as far as we are concerned, there are real reasons why we have to actually support the suspension of alcohol. The bed numbers were actually getting filled, and therefore we were running out of beds, and we proved it. And everywhere, all the hospitals showed us the figures. Everybody knows this, and I think when we talk about it, we must be aware. We are dealing with a situation where there are avoidable situations which we should try and reduce as a source of pressure in getting the wards and intensive care beds and the additional staff and so on. That's what we're managing. And I think we must focus as South Africans. We're dealing with the lives of people. Let's try and focus that and prioritize that. Everything else will open up as soon as the numbers settle down. We shouldn't really be dealing with it as though there's a need for a contest here. We're not contesting anything. We just want to make it clear that what is going to disturb the ease with which we are managing the beds and the patient numbers and improving the care of the patients, we will actually stand up and advocate that those must be avoided until we are over that hump. Right now we're going through the surge, and I think South Africans do appreciate that we are going through a surge, and the surge is very unpredictable. We don't know what's going to happen. We're very hopeful. So we want to keep to that. There are reasons why we did it, and we are going to have to go and answer this matter in court, and we'd like to keep it like that.
No?
Thanks for the opportunity.
Azwakali, get closer.
Thanks for the opportunity, MEC. Minister, these facilities here today are proof that since the outbreak of COVID-19, the provincial government have made some strides, and there are success stories. However, having said that, there is also a narrative that is being pushed, partly also by opposition parties, citing examples such as the one in North there, to say that these facilities are not safe. In fact, you have, like on social
Health Minister Dr Zweli Mkhize in Richmond in KwaZulu-Natal there, answering questions from the media. The last question before we got cut off, we'll try and get the answers to a little bit later on. He was being asked about the tobacco ban that we just showed you that was playing out in the Western Cape Court. And he said this is about people's lives, and he's not going to answer what's happening in court already, but the actions that government is taking is to try and save people's lives. So it's time for us to take a short break. When we come back,